Hello all, I'm Dr. Gokay Bilgin from Smile Hair Clinic. Today we are going to check our patient Christian's journey of his hair transplant. If we look the pre-op pictures, we can see that he has a large forehead. His main concern was to cover the forehead. So we drew a hairline at the end of his facial muscles. As you can see in these pictures, we lowered the hairline like 4 centimeters. And after the incisions, we made him dense incisions, and after the incisions, I also figured that he has some hair loss in the mid-scalp too. So how does he look to cover the midsection of the hair too? Because period of the operation, we were only thinking to cover the front. We can just see the first month results here. Of course, it's still healing and there is not much density here, but you can understand that we covered the front really nice. And also you can see that we also covered the midsection and the crown too. And let's jump to the 6 months. 6 month results. The hair is growing, but it's not as much as we want. And also donor zone looks much better than the first month. Some of our patients think that they had over harvesting because of the look of the donor zone in the first month. But please remember that whatever we do is decreasing the circulation in the scalp, in the recipient zone, in the donor zone too. So even if the hair is growing in the donor zone in the first month, it's not as its best, okay? It needs several months for the circulation to be completely normal, and then your hair will grow. The most of the hair in the donor zone also goes into the rest state. So in the 6 months, you can see that his donor zone is completely healed, his hair is pretty good, and his crown is covered really well. He combed them in a way, and you can see the density in the crown. In the front, he has less hair than the crown because, as we talked, I made incisions in the top and the crown too. We changed the plan during the operation, the consult of the patient. So, but they started to grow in the 6 month pictures. You can see clearly. And now we have the 12th month photos. If you see these photos, they are pretty good. His donor zone is completely healed. His crown is fully covered. You can see from the back, it looks really nice. And the style of his hair in the front is pretty sharp. He made, I guess he used spray. He made a really nice styling for the front, and it looks pretty well. Of course, maybe in the future we can increase density. We also discussed this option with our patient in the front because we fixed both crown, front, and midsection too. So if we are working in a very large zone, it's never possible for us to cover it in one session. But for this patient, we reached a density that meets his expectations both in the front and in the crown, so it's a success for us. We must always know that if you need a lot of hair, you will have 2 sessions. Okay, some people may promise you that they will cover it in one session, but it's never impossible. Of course, they can give you coverage in the whole head, but the density will be really less and you will be very unhappy at the end. Thank you.